Welcome back. The death by suicide of a police officer in Delft in Cape Town on the 8th of September has again brought the issue of mental health within the police force into sharp focus. It's been revealed that more than 300 police officers have died by suicide in the past 7 years. Joining us to discuss this further is Lesiba Thobakgale. He is the South African Policing Union's national spokesperson. Good evening, Mr. Thobakgale. Thank you very much for joining us on the program. Now, these figures are quite worrying because for everything that police officers are exposed to, from decomposing bodies to attending to scenes where women or children have been violated in the most horrific of ways, one assumes that no cent would be spared for their mental wellness. Just talk to us about the rate of suicides that we're seeing in the force.
Thank you so much, Mfundo, for having us, and good evening to your viewers. Indeed, as the South African Policing Union, we are clearly concerned about the number of suicides that some of our members, they happen to end up losing their lives. And indeed, you spoke well, which is the reality that our members are faced with, where they lose their lives and the type of situations that they are faced with, attending to different types of crime scenes, which at the end of the day, when one finishes their shift, it warrants for them clearly to go and be debriefed before they could go home. And over the years, we have seen, the component that deals with the wellness of the police officers really not clearly doing what is expected of them because of the shortages that they are having there. So that is why, as the South African Policing Union, we are indeed saying that to the police minister, he has to make sure that he deals with issues that has to do with employee health and wellness. The challenges that are there, they've been there for a number of years, and we continue to see the numbers indeed escalating. The solution to that is that those professionals, they need to be allowed to practice as professionals. And as far as you still have them in the South African police services, and they are still given the ranks to be called the warrant officers or the colonels and so on, the recommendations that they are making, they will continue to be undermined. So that is why we are saying that that service should be outside the South African police services so that they can clearly be able to operate as professionals. They can be able to make recommendations as professionals, and those recommendations can be followed accordingly.
Lesiba, you have spoken of two aspects that are important to delve deeper into. Firstly, just for clarity, are you saying there are not enough officials that deal with the debriefing sessions?
Unfortunately, if we are talking about the issue of debriefing, Fundo, it is clear that after each and every shift, you can imagine the type of gruesome scenes that members do attend in different police stations across all the 9 provinces across the country. Definitely, there is no capacity that is able to give those members debriefing. Those who have attended such scenes, those who have attended shooting scenes where themselves they have been shot at or where they were involved in any form of shooting. So over the years, it has been a reality that our members are clearly faced with, because in most cases you find that they go home without being debriefed, and you can imagine the type of trauma itself that it leaves our members with, where when they go home, in most cases we will go and you find that there is an issue of domestic violence that would stem from home, but we don't go to the root cause thereof. We don't go and say what is really causing these types of issues. If a commander comes there, the only thing they come and say, okay, Thobakgale is involved in a domestic violence, let's take the firearm from him. But there are no solutions to say, okay, how then do we really assist this member? How do you really make sure that we really avoid such a situation for it to happen even in the first place? Because we believe that it is better to prevent this issue that has to deal with mental health of our members by making sure that employee health and wellness, that function, it is out of the South African police services. They are those who are indeed professionals. It is a professional type of a function, and it needs to be performed.
And I want to deal with that, the ranks issue. Pardon me for interjecting there, but I want to deal with that issue because ever so often we've had numerous conversations on this issue of mental health within the police force, and ever so often it seems as though sometimes the resources would be there, but a number of senior officers would not want to be debriefed by juniors. They wouldn't want to be vulnerable to juniors. So this is what you actually touch on, that perhaps it needs to be removed from within the force and you have people externally coming to assist.
That is what we are saying, Fundo, because remember, the South African Police Services, in its nature, it is militarized. You can never be able to change that. And it being a militarized organization, it means the issue of rank, it is the one that is supreme to say, okay, who am I dealing with here? If I happen to be, if one happens to be a senior manager within the South African Police Services, I would give an example of a rank of a colonel or a brigadier. It is not so easy. Even if one can be a professional, they can be a psychologist, they can be a social worker, they can be even a psychiatrist or any profession that relates to wellness. But for one to go and clearly be vulnerable to someone who is of a lower rank, that on its own, it is a problem because of the militarization structure that the South African Police Services has. That is the reality that we have. And further to that, the very same higher ranking officer whom, when a member would come and say, okay, a warrant officer or a captain gave me these recommendations to say after the trauma that a member has experienced, then the member needs to be given some time off from the very same working environment that caused the trauma of that member. They need to have some time where they will cool down from that, where they are going through sessions with the very same professionals so that they could indeed be assisted. You deal with that situation that they are faced with. And when it gets to a higher ranking member, they, in most cases, they are looking at dealing with the issue of crime. You find that that very same member, it is the hardworking one, it is the one who's bringing results, is the one who is known to be active. Then they would say, no, one would look at prioritizing the issue of fighting crime and without prioritizing the health and wellness of the members. That is the reality that is faced with our members out there, simply because that recommendation, it was clearly given by someone who is of a lower rank. So it is just the nature of the organization. So there is nothing that one can do about it except making sure that that function, it is outside the South African Police Services, so that
but
whatever
what has
that comes,
been the response of the South African Police Service? Because Lesiba, you and I have spoken about this on numerous occasions. You've made this call. It's a long-standing call of SAPO. What has been their response to remove this health and wellness from the force?
Unfortunately, there hasn't been any positive response, to an extent where we even tabled a position paper within the bargaining council where we even spoke about to say there need to be a specific structure, there need to be, something. And that structure that we are talking about, it is outside, a structure outside the South African Police Services. There need to be a specific policy that also guides the very same, so that the issue of the ranks, the issue of any other things, because that structure will clearly take care of issues of remuneration. It will really take care of the issues of benefits, unlike when they are within the South African Police Services, because if they are in here, they are then bound by the policies, they are bound by everything that is within the police services. But unfortunately, it's been over the years, in the bargaining council, there hasn't been any movement, to an extent where we even tabled a draft agreement to say, this is how you can do it, after we have done, quite a research around it, to say, this is how you can really do it. But there hasn't been anything that was forthcoming. That is why now we are saying that to the new police minister, he needs to look at this issue, indeed to give it attention, because as much as he wants the police officers to be out there to be dealing with crime, as the efforts of the police, which we clearly appreciate that we are seeing, under the new minister, the efforts that are being made, but he needs to as well make sure that the mental wellness of our members are clearly taken care of. And this very issue that we are demanding, that is what we are putting it to him, that he needs to take a clear action, because the issue of mental wellness, it is important. If it is important to everyone in this country, to every citizen, or even across the world, what more of police officers who are faced with different types of situations where one has to sit and be able to cordon a specific scene, be able to do everything, write up a docket, be able able to collect every evidence that is needed in a cash, maybe it can be a cash in transit, it can be a crash site, it can be a murder site, or whatever that one can think of, whatever that is quite traumatizing. But
most certainly they need this service. No, they must certainly need this service. Lesiba, fortunately, we will be speaking to Major General Busi Themba in just a moment to respond to some of the issues that you've just put across. Thank you very much, though, for joining us this evening. That's Lesiba Thobakgale. He's South African Policing Union National Spokesperson.